If you notice that your breathing suddenly jumps when you climb stairs, and you find yourself unable to finish a short sentence without pausing for air, that moment is actually telling you something important about your heart and lung fitness. It is not just being out of shape, and it is not just getting older. That specific point where your breath spikes on stairs is what I call the stairs breath signal. And today, I want to show you exactly how to recognize it, what it usually means, and what you can do about it starting this week. In just a few minutes, I am going to walk you through a simple 30-second check you can do safely at home with or without actual stairs to see where your breathing stands right now. I will also give you a 2-sentence message you can bring to your doctor that tells them exactly what they need to know. And most importantly, I am going to share one specific change, not a workout program, not a complicated exercise routine, but one practical adjustment that many people find makes stairs feel noticeably easier within about a week. So stay with me through this whole video because everything I am about to share builds toward that payoff at the end. Before we go further, I would love to know who is watching today. If you are comfortable, drop a comment with your age and where you are watching from. Whether that is your living room, your kitchen, maybe you are on your phone in bed. And if you are a caregiver watching on behalf of someone you love, just type the word caregiver so I know you are here too. It helps me understand who I am talking to, and honestly, it helps other viewers feel less alone when they see that comment section full of people just like them. Let me paint a picture that I hear about constantly from my patients, and I suspect you might recognize yourself in one of these scenes. You are walking up a flight of stairs, maybe at home, maybe in a parking garage, maybe at a family member's house, and you are carrying something light, perhaps a small bag of groceries or your purse, or just your phone. You start climbing at a normal pace, nothing rushed, and somewhere around the 4th or 5th step, your breathing changes. It is not gradual. It almost feels like a switch flips. Suddenly you are aware of your heart pounding in your chest, your breath is coming faster, and you find yourself gripping the handrail not because your legs are weak, but because your whole body feels like it needs to slow down. Maybe you keep going, but by the time you reach the top, you need to stop and catch your breath before you can speak normally. Or maybe you have noticed that you used to chat with someone while climbing stairs, and now you cannot get a full sentence out without pausing. Perhaps you have started avoiding stairs altogether, choosing the elevator or the ramp, or rearranging your day so you do not have to go upstairs as often. Here is what I want you to understand. Stairs are essentially a built-in stress test that your body encounters in everyday life. Unlike walking on flat ground, climbing stairs demands significantly more oxygen delivery and significantly more work from your leg muscles in a very short period of time. Your heart has to pump harder, your lungs have to work faster, and your muscles need more blood flow all at once. This is why stairs reveal things about your cardiorespiratory fitness that flat walking might hide completely. You might walk around your neighborhood just fine, but stairs tell a different story, and that story is worth listening to. Now, in a moment, I'm going to show you how to do a quick breathing baseline check right where you are sitting. No stairs needed yet. So you have a reference point before we get to the stair check itself. But before that, I want to explain briefly what changes in the body that make stairs feel harder as we get older, because understanding this helps everything else make sense. As we age, several things happen simultaneously that affect how our body handles the demand of stair climbing. The heart's ability to increase its output quickly can decline, meaning it takes longer to ramp up to meet sudden demands. The lungs may not exchange oxygen quite as efficiently as they once did. The muscles in your legs, even if they still feel reasonably strong, may have lost some of their endurance capacity and their ability to use oxygen efficiently during work. And there is also something called deconditioning, which simply means that when we are less active, whether because of a health setback, a change in routine, or just the gradual drift that happens over years, our cardiovascular system becomes less trained to handle challenges like stairs. This is not a character flaw, and it is not inevitable decline. It is simply what happens when the body gets less practice at demanding activities. And the encouraging news is that this particular factor responds remarkably well to the right kind of gentle, consistent practice. There are other contributors worth mentioning too, things that can make breathlessness on stairs worse beyond simple deconditioning. Anemia, which means having fewer red blood cells to carry oxygen, can make any exertion feel harder. Poor sleep can affect how well your heart and lungs coordinate during effort. Certain medications can influence heart rate response or cause fatigue. Lung conditions and heart conditions of various kinds can certainly play a role. I am not going to go deep into any of these, because that is between you and your clinician. But I want you to know that if your stair breathing has changed significantly, especially recently, it is worth a conversation with your doctor to make sure nothing else is going on that needs attention. Here is something I want you to do with me right now, and it takes about 10 seconds. This is your baseline breathing check, and you can do it right where you are sitting. Take a normal breath, and then say out loud or in your head the following sentence at a normal talking pace. I am checking my breathing, and I feel fine right now. That is about 8 or 9 words, and it should feel easy when you are at rest. Your voice should be steady, you should not need to pause for air in the middle, and you should not feel like you are pushing to get the words out. This is what comfortable baseline breathing sounds like. I want you to remember this feeling, because when we get to the stair check in just a few minutes, you are going to compare how you feel at the top of the stairs to how you feel right now. The question is not whether you can speak at all. The question is whether speaking a short sentence feels as easy as it just did, or whether it feels significantly harder. This simple comparison is actually what clinicians pay attention to when they want to understand how someone's body is handling exertion. It is not about numbers or scores. It is about whether the effort of speaking changes in a way that tells us your cardiovascular system is working near its limit. Now, I know what some of you are thinking. You are thinking, well, of course I am going to be more breathless after climbing stairs. That is just exercise. And you are right, some breathlessness with exertion is completely normal and expected. The question is degree and recovery. Normal exertion breathlessness means you are breathing harder at the top of the stairs, but you can still get a sentence out. Maybe a little choppy but not gasping, and within about 60 to 90 seconds your breathing has returned to something close to normal. Concerning breathlessness is different. Concerning breathlessness is when you cannot finish a short sentence without stopping to breathe. When your breathing feels out of proportion to what you actually did, when you feel lightheaded or faint along with the breathlessness, when there is any chest pressure or discomfort, or when recovery takes much longer than it used to. Let me give you the 30-second stair breath check now, and I want to be very clear about how to do this safely. If you have actual stairs in your home and you feel comfortable using them, here is what you are going to do. Wait until you feel rested and calm, not right after a meal, not when you are rushed, not when you are already tired from other activities. Walk to the bottom of your staircase and stand there for a moment with one hand on the railing if you have one. Then climb at an easy pace, not your fastest, not trying to prove anything, just one step at a time, at a comfortable rhythm. If you have a short flight, maybe 4 to 6 steps, that is fine. Climb to the top or to the landing, then stop. Within about 5 seconds of stopping, try to say out loud a short sentence like, I made it to the top, and I feel okay, or simply count out loud from 1 to 5 at a normal pace. Notice how that feels compared to when you did the baseline check while sitting. Can you get the words out smoothly? Or do you have to pause to breathe in the middle? Does your voice sound steady, or does it sound strained? Does your breathing feel elevated but manageable, or does it feel like you cannot get enough air? There is no score here, no pass or fail, just information. You are gathering data about where your body is right now. If you do not have stairs at home, or if stairs feel unsafe for you right now, there is an alternative that gives you similar information. Stand next to your kitchen counter or another sturdy surface where you can hold on lightly for balance. Then step in place, lifting your knees comfortably. Not high stepping like a marching band, just normal stepping for about 30 seconds. Keep a rhythm that feels like you are actually going somewhere. Not lazy, but not rushing. After 30 seconds, stop and do the same sentence check. This step-in-place version is gentler than actual stairs because it does not have the same vertical demand, but it still gives you useful information about how your cardiovascular system responds to light, sustained effort. Try one of these with me right now, if you are in a safe position to do so, or make a mental note to try it right after this video ends. Either way, I want you to have this personal reference point because the strategies I am about to share work best when you have a sense of where you are starting from. Now, here is the mid-video question I want you to think about, and I would love to hear your answer in the comments. When it comes to stairs, do you find yourself more winded going up, or do you feel more unsteady and concerned going down? For most people, going up is the cardiorespiratory challenge, the part that gets you breathing hard and makes your heart pound. Going down is often more of a balance and joint concern, though it has its own physical demands. But I find that people have very different experiences, and understanding your particular challenge helps you know what to work on. So drop a comment and let me know which direction bothers you more, up or down, because I genuinely want to hear from you, and other viewers often find it helpful to see that they are not alone in their experience. Now, I am going to give you the one change that can make stairs feel easier within about a week. And I want you to listen carefully because this is the practical payoff I promised you at the beginning. The change has two parts that work together: pacing with purposeful breathing and what I call micro-dose stair practice. Let me explain each one. When most people climb stairs, especially if they have started to find stairs difficult, they hold their breath without realizing it. They tense up, they grip the rail tightly, and they try to get up the stairs as fast as possible because they want the discomfort to be over with. This approach actually makes everything worse. Holding your breath increases the pressure in your chest, makes your heart work harder, and causes your oxygen levels to dip right when you need oxygen most. Rushing up the stairs spikes the demand beyond what your cardiovascular system can comfortably supply, leading to that gasping, breathless feeling at the top. And the tension you carry actually wastes energy and makes your muscles work less efficiently. The alternative is to climb with intentional breathing and a pace that matches what your body can actually deliver. Here is how it works. Before you start climbing, take one slow breath in through your nose. As you lift your foot to take the first step, breathe out slowly through your mouth. Let your breath out during the effort of stepping up, not during the pause between steps. When your foot lands, you can take a brief natural inhale. Then exhale again as you step with the other foot. This exhale on effort pattern does two things. It keeps you from holding your breath, which is protective for your heart and lungs. And it creates a natural rhythm that automatically slows you down to a sustainable pace. You cannot rush when you are coordinating breath with steps, and that is exactly the point. Let me do this with you right now while you are seated, just so you can feel the rhythm. Place your feet flat on the floor. Now, breathe in gently. Then breathe out slowly as you lift one knee just a few inches, like you are taking a slow step. Breathe in as you lower that foot. Breathe out as you lift the other knee. Breathe in as you lower it. That rhythm, that slow exhale during the effort, is what you are going to use on actual stairs. Most people find that just this breathing adjustment, without any change in their actual fitness, makes stairs feel noticeably more manageable within the first few days of practice. The second part is microdose stair practice. And this is crucial because the natural tendency when something becomes hard is to avoid it completely. I see this all the time with my patients. Stairs become uncomfortable, so they stop taking stairs whenever possible, which means their body gets even less practice at the specific demands of stair climbing, which makes stairs even harder, which makes them avoid stairs even more. This is a downward spiral, and the way to reverse it is not through heroic stair workouts, but through small, frequent, intentional exposures that gradually rebuild your capacity. Here is what micro-dose stair practice looks like in real life. Instead of avoiding your stairs entirely, you are going to climb a small number of steps, maybe just 4 or 5, once or twice a day using the breathing pattern I just taught you. You are not trying to exhaust yourself. You are not trying to prove anything. You are giving your cardiovascular system a brief practice session that says to your heart and lungs and muscles, this is a demand we need to be ready for, let us get a little better at it. If you have a landing partway up your staircase, use it as a planned reset, not as a sign of failure. Stop at the landing, take 3 or 4 slow breaths, let your heart rate come down slightly, and then continue if you feel ready. The landing is not where you failed. The landing is where you succeeded at pacing yourself intelligently. Over days and weeks, you will likely find that you need the landing less, or that you can climb more steps before you need it, or that your recovery at the top happens faster. This is your cardiovascular system adapting to the demand, and it happens more quickly than most people expect when the practice is consistent and appropriately dosed. If you do not have stairs at home, you can do the same kind of microdose practice using a single step, like a sturdy step stool or your bottom stair, stepping up and down 4 or 5 times with the same breathing pattern. Or you can continue with the step-in-place version I described earlier, gradually extending the time from 30 seconds toward 45 seconds or a minute as it becomes more comfortable. Let me describe what a week of this looks like in practical terms, because I know that abstract advice is hard to follow without a concrete picture. On the first day or two, you are simply practicing the breathing pattern, maybe while seated or doing very gentle stepping in place, just to get the rhythm into your body. You are also doing your baseline sentence check, so you know where you are starting. By the 3rd or 4th day, you are incorporating the breathing pattern into actual stair climbing or step practice, doing 1 short exposure in the morning and 1 in the afternoon if your schedule allows. You are not pushing hard. You are stopping before you feel gasping or distressed. You are using the landing or a pause as needed and not judging yourself for needing it. By the 5th or 6th day, you might notice that your breathing feels slightly less spiked, or that you recover a few seconds faster, or simply that you feel less anxious about the stairs because you have been practicing them intentionally instead of avoiding them. By the end of the week, try the 30-second stair breath check again and compare your sentence fluency to when you started. Many people notice a real difference, not dramatic but real, and that difference builds confidence that motivates continued practice. Throughout this week and beyond, I want you to honor your stop rules. If you feel dizzy, stop and sit down. If you feel any chest discomfort, stop immediately. If you feel unusually fatigued, that is your body saying it needs rest, not more pushing. If anything feels wrong, pause the practice and check in with your clinician before continuing. This is meant to be gentle, sustainable, confidence-building practice, not an aggressive workout that leaves you depleted. Now, let me give you the 2-sentence doctor message I promised, because I know that many people find it hard to describe what they are experiencing in a way that helps their clinician understand the situation quickly. If you decide to talk to your doctor about changes in your stair breathing, here is a template you can use. Say something like, over the past number of weeks or months, I have noticed that climbing stairs leaves me more out of breath than it used to, and I need to stop to catch my breath more often before I can continue or speak comfortably. I have not noticed any chest pain. Or, I have also noticed, describe any associated symptoms like ankle swelling, fatigue, or palpitations. That gives your doctor the onset, the change over time, and any associated symptoms in a way that immediately helps them understand whether this needs workup or whether it sounds like deconditioning. You can adjust the details to match your actual experience, but the structure is what matters. When did this start? How has it changed? And what else have you noticed? Doctors hear a lot of vague complaints about being tired or out of shape, but when you describe a specific functional change, a specific timeline, and specific associated symptoms, it paints a much clearer picture that guides their thinking. Before I wrap up, I want to take just a moment to say that if this video has been helpful to you, or if you think it might help someone you care about, I would be grateful if you would click the like button and consider subscribing to this channel. I create these videos specifically for people over 60 and those who care for them, focusing on practical, safe, evidence-informed strategies that help you maintain your independence and confidence as you age. Subscribing means you will not miss future videos, and it helps more people find this information when they search for help with these exact concerns. Here is what I want you to take away from everything we have talked about today. The moment your breathing jumps on stairs is information, not a verdict. It is your body telling you something about the current state of your cardiovascular fitness, and with the right approach, that state can improve even after 70, even after 80, even if you have not exercised formally in years. Your assignment this week is simple. Do the 30-second stair breath check or the step-in-place version safely, noticing how speaking a sentence feels at the end. Practice the exhale on effort breathing pattern until it becomes natural. Do 1 or 2 brief micro-dose stair exposures per day, using the landing as a planned reset and stopping if anything feels wrong. By the end of the week, check again and notice whether the top of the stairs feels even slightly less daunting. Then come back to this video and leave a comment telling me what you noticed. Did the breathing pattern help? Did you find that you needed the landing less? Did the stairs feel less scary once you started approaching them intentionally instead of avoiding them? I genuinely want to know how this goes for you, because every comment helps me understand what is working and what to focus on in future videos. And if your breathing on stairs is new, getting worse, or associated with any of the red flags I mentioned, please prioritize a conversation with your clinician before trying to manage this on your own. There is no shame in needing evaluation, and catching certain conditions early can make an enormous difference in outcomes. Thank you for spending this time with me today. Your breathing on stairs can get better. Your confidence can get better. And you deserve to feel capable and safe in your own home and out in the world. I will see you in the next video.